calcium channel blockers, they do not affect the serum calcium levels, okay? Just understand that. What these medications do is that they slow down the exchange of calcium from in and out of the cell, so it reduces the electrical impulse. Does that make sense? Lie to me.
Yes.
That's good, that's good. So that's what this is. It slows down the electrical conduction, the exchange of calcium, so it does not affect your serum calcium levels, okay? But what you do have to know is what they end in. They end in dipene. And earlier I was talking about calcium channel blockers. I didn't say what they end in. They end in prils. I'm sorry, ACE inhibitors. They end in prils, okay? But anyway, so back to calcium channel blockers. Most of them end in dipene, right? But you also have this one particular medication called verapamil. Verapamil does not end in dipene, but nonetheless, you now know it. Now, all of these drugs, calcium channel blockers, they will reduce the excitability of smooth muscles because that's what happens when you block the activation of calcium. Calcium excites smooth muscles. That's what it does. And it constricts them, right? But if somebody has hypertension, you give them calcium channel blockers, it blocks the excitability of the calcium in the muscle and the blood vessels relax and they dilate. Does that make sense? Mm-hmm. You have to take considerations when giving medications like verapamil. This is a very important concept. There's something called a heart block. Y'all familiar with that? A heart block is when, you know how we have the SA node here, and then you have the little fibers that go here, and you have the AV node there, you have the intra-atrial node, you have the bundle of His, you have the left, you have the right bundle branches, and you have the Purkinje fibers. Those are the wires, the electrical wires, let's say, the fibers, that conduct electrical impulse throughout the myocardium, throughout the heart muscle. So when you give these medications, they slow that down. So they effectively reduce heart rate, they effectively relax smooth muscles, and that's how we reduce blood pressure. Does that make sense, folks? But if somebody has a heart block means that when we talk about your PQRS, T wave, that this little PR interval that the AV node normally creates, that little small fraction of a pause, it's prolonged. And so I think we discussed that before. P wave, we have your P, then the QRS, T. You see how right here it's much longer? Mm-hmm. That's what a heart block is. You cannot give these medications when you have a patient that has a heart block because the electrical impulse is already slowing down. It's not passing through this in its normal pattern. So we're not going to give a calcium channel blocker because it's going to furthermore slow down the electrical conduction and it may kill the patient. Does that make sense? Mm-hmm. We use calcium channel blockers for a lot of arrhythmias also, abnormal rhythms, but not heart block. Okay, usually fast rhythms like ventricular tachycardia, SVT, supraventricular tachycardia. Does that make sense, folks? Mm-hmm. Any questions on calcium channel blockers?
Nope.
Okay.